in 2003. And it was simple. I went for my yearly OB/GYN appointment. They asked you a battery of questions. Is everything okay? Are you doing your own self-breast exams? Is there any chance you could be pregnant? I answered all the questions honestly, and I left that day with the greatest news ever. I was pregnant. I couldn't wait to go home, share the news with my husband, call my best friends, talk to my family. I was overjoyed. About a week later, I got a letter in the mail from my OB/GYN telling me that my pap smear came back abnormal. I was scared. I was pregnant, I was scared. I did what anyone would do. I hurried up and picked up the phone, panicked, called. They calmed me down. They said, this is something not that abnormal. This happens to a lot of women. What we're gonna do next is a LEAP procedure where they actually biopsy a small piece of your cervix. I scheduled that appointment, I went back in, and 2 weeks later, I got the results of that biopsy. I had high-grade dysplasia, precancerous tissue. Again, scared and frightened, I called the doctor, and they said, well, the next procedure is a cone biopsy, but this time we have to take a larger piece of your cervix. And what that means is that I had to make a choice. I couldn't do it. It was contraindicated while pregnant. I had to decide, did I want to have my child, or did I want to go through and treat what was going on in my body? I was halfway through my pregnancy, so at that time I decided to have my daughter. And on May 10th of 2003, I gave birth to a beautiful 5-pound, 8-ounce bundle of perfection, a little girl that goes by the name of Willow. What's also significant about that day, it's also my birthday, so it was a huge celebration. And I enjoyed being a mother. I enjoyed every aspect of it, but I had this thing hanging over my head. I had to address the dysplasia. So I went back in after a month for the cone biopsy, and I got the worst news ever. It had transitioned into full cancer. So my next option was to have a hysterectomy. And I figured that was fine. I was only 26 years old, but if a hysterectomy was going to allow me a lifetime with my daughter and my family, then it was truly worth the risk. I went in, I had the hysterectomy, and it was uneventful. I was walking 2 days later. I felt like Superwoman, in a little bit of pain, but up and walking, ready to go home. I went home, and 2 weeks later, I ended up back in the hospital. I had an incisional infection. I had to go in and get my incision lanced. I had drains placed in, and I was on PO antibiotics. Again, discharged back home. I was home again, and I never felt right. I felt weak. I felt like I couldn't get a deep breath. I felt like I was getting weaker and not stronger. I went back. They ran a chest x-ray to see if I had pneumonia. That came back negative. 2 weeks later, I was back in the hospital again, coughing. They were checking me for pneumonia again. But I had a productive cough, so somebody took a sputum sample. They promised in 7 to 10 days, they would call me with the results of that sputum sample. During that 7 to 10 days, I was becoming increasingly weaker, and I found it difficult to take care of myself and my child, who was still a newborn baby at the time, about 5, 6 months old. I went to stay with my parents. 10 days later, the telephone rang, and it was the results of the sputum sample. They said I needed to get to the nearest emergency room. For me at that time, it was Johns Hopkins Bayview. They said I have diphtheria. I went into the emergency room, escorted by my father. Further testing proved that it was not diphtheria. I actually acquired MRSA, most likely from the hysterectomy, in both of my lungs. That's why I couldn't breathe for the last couple of months. They immediately started me on IV antibiotics. And for some weird reason, that day, that particular point in time, I had an allergic reaction to the IV antibiotics. It shut down my kidneys. So now here I am, 26 years old, a new mom, my kidneys working at only 50% capacity, my lungs only working at 50% capacity. The only option left that the doctors could come up with at Hopkins was to put me in a medically induced coma. On February 7th, I went into a medically induced coma. I did not come out of that coma until March 30th, almost 7 weeks later. I can't tell you what that's like. to be placed in a medically induced coma. Have you ever seen, well, we've all seen that commercial. This is your brain on drugs. That's exactly how I felt. I felt like a pan full of scrambled eggs. By the time I left the hospital, it was June. I actually went in February and didn't leave until June. I used this picture because this is what I looked like. At this time, my daughter was 1. Remember, she was born May 10th. You can see my clavicles protruding. My hair was falling out from the chemo and the radiation. What you don't see in this picture is that I was unable to walk. My wheelchair is 20 feet to my right. I have bilateral AFOs, ankle-foot orthotics, on both of my feet. 3 of my front teeth had rotted from the heavy medications. And this is where I was left when I left the hospital. But this is actually a story of recovery. My secret weapon: I am very willful. I am very stubborn. I am a natural-born fighter. I also had an amazing support system between my family and my daily encounters. And people ask me, what do you mean by your daily encounters? It's simple. When you're in the hospital, life as you know it completely changes. It's not you put on TV, you put your feet up, you cook dinner. No. Your life is your daily encounters. It's every person who comes in and out of your room every day, no matter who they are. If they're collecting your trash, if they're dropping off your tray, if they're doing a med pass, if they're clearing your trach and suction you. Those people become your daily encounters. As soon as I learned how to do a bed to wheelchair transfer, I would wheel myself out into the hallways at night, go past the nurse's station. I would only do it at night because I didn't like people seeing me. I didn't like the hustle and bustle of a busy hospital. And I'd go past the nurse's station, past the security desk, and I'd go out front, and I'd sit on the front porch of Johns Hopkins Bayview Long-Term Care Facility, the John Burton Center, and it's up on a hill. And I would overlook Baltimore City at night. The lights, the quietness, it just gave me a sense of peace. And every night, the security guard took his 15-minute break when I was out there on the porch. Not once did he ask me, why are you here? You're so young, why are you here? Not once did he ask me if I was getting better. He talked to me about spring training, the Orioles, teaching his teenage son to drive. He was the first person who stopped treating me like patient in room 107, bed 2, and actually started treating me like a person again. What he did for me was amazing. Again, I didn't get out of the hospital until June, which means I celebrated my daughter's first birthday while I was in the hospital. It was also my birthday and my first Mother's Day. For a parent, your first birthday for your child is like a huge milestone. The kid doesn't remember, but for you as a parent, you're going all out. You want to see him smash that birthday cake, and I couldn't do that because I was in the hospital. I had no control over what was going on with me. I had formed a relationship with my caregivers because they were part of my daily encounters. The GNAs, the nurses, and some of the respiratory therapists got together and decorated their break room and threw me a surprise birthday party for myself and my daughter. Not only that, they went out of their own pocket and bought my daughter a couple of outfits and some gifts. That was absolutely amazing. Because we don't get better alone. It takes a team of people to help the patient get better, a whole multidisciplinary team, which is a group of healthcare workers from different disciplines who come together. They bring their skill set to the table to treat the patient. And I want to emphasize that because it was everybody in that skilled nursing facility who came together to treat me, to get me where I am today. Those were my daily encounters. We have the ability to make a difference in someone's life as we slowly put the pieces of their life back together again. Another example, I would sit in my room and I was so depressed and I was sad because I didn't have independence. I didn't have freedom. I didn't have function. I didn't have my mobility. And I didn't want the sun in my face. I didn't want people coming in my room. I was that patient that no one wanted to have. I put a sign on my door. Do not come in after 10 p.m. for vitals. I'm fine. Unless I ring my call bell. But this one housekeeper would come in every day to pull my trash, wipe down my bedside table, and ask me if she could open my blinds for 20 minutes. Every day I told her no. One day I got tired of telling her no, and I figured if I just said yes, she'd leave me alone. The the point of it is I like that sunshine. That 20 minutes felt good. That 20 minutes turned into 40 minutes, which turned into 60 minutes, which turned into me changing my perception and allowing the sun in. What all these people utilize from that multidisciplinary team is a therapeutic use of self. It's our natural ability as healthcare workers. The most widely cited contemporary definition of therapeutic use of self are planned insights and use of personality and perception and judgments as part of the therapeutic process. And that's what these people use when treating me. A therapeutic use of self is forming a relationship that provides comfort, confidence, and safety to improve your patient's health care and their well-being. It utilizes self-awareness, and this is really important, because you have to know what to say and when to say it, and what not to say, and when not to say it. It's found in verbal and nonverbal communication. Sometimes a therapeutic use of self is as simple as a touch on the shoulder, a touch on the hand, a nod of agreement, or even a smile. So I was treated from a multidisciplinary team utilizing a therapeutic use of self, and there was still one missing component. They were slowly putting the pieces together that were me, but that missing component was me, my investment in my recovery. I had a physical therapist who would come to me every single day and try to get me to get up and walk. And then she would argue with me about not brushing my hair before I came to rehab, telling me I was frightening the other patients. I didn't care about my hair. I had cancer, my hair was falling out. I really didn't care. And I surely didn't like her for commenting on my hair. And I had an OT who would utilize her treatment sessions when my daughter was there. She would come into the room, and she would wait for my parents to bring my daughter up, or my husband to bring my daughter. And she would come into the room, sit my daughter at the end of the bed, and have me reach across the bed to feed my daughter, because my daughter was just starting to eat regular food and off formula. So I would reach. Then she started strapping weights, making it less fun to feed my daughter. But I would still feed my daughter, and I would reach. And one day, the OT said to the PT, "Why don't you co-treat with me today? You want Jessica to participate, come co-treat with me, and do me a favor, leave the walker behind and bring weights." What these two women did that day is they came to my room and they grabbed about 30 pounds worth of weights, and they weighted down the bottom of my daughter's stroller. And this is that huge stroller that screams to the whole world, "Look at me, I'm a new mom, I can do it all." You put the car seat on top, you can put your diaper bag on the bottom, you can fit everything in that stroller. They weighted it down with about 30 pounds. They strapped 2 AFOs, one on each of my legs. They put a gate belt around me. And these two women helped stand me up, the occupational therapist and physical therapist. And they walked me down the hall. And for the first time, I was able to walk 10 feet, not with a walker, but with a stroller, with what a 26-year-old mom should have been doing. They used a client-centered approach, an approach that required me to take an active role in my own health care. They were being supportive and non-directive. A client-centered approach is about people, their relationships, and their goals. And this is what that OT and that PT did today. They understood me. They understood what I wanted. A client-centered approach differs from practitioner to practitioner, but it encourages clients' decision-making and a support of ideas, strengths. It's about the client's self-efficacy. You're getting the client to invest into their own recovery. It's a partnership between the practitioner and the clients. It's an emotional exchange. What they did for me that day, they understood me. They understood my intrinsic motivations. They understood my goals. My goals were to be a mother, a wife. My goals were to walk again. My goals were to be a 26-year-old woman again. I wanted a career. And these women understood that day. They put me at the center. They put the person at the center. Notice I say the person. It wasn't my diagnosis now that was at the center, because I had many. I had MRSA, I was vent, I was trached, I had a stage 3 sacral wound, I was catheterized. They put me at the center, not all those diagnoses going on around me. They understood who I was. And this is actually such a big, hot topic issue today. Providers, February 2017 magazine, has their whole quality forum on the person-centered care, about how we need to include person-centered care according to our CMS guidelines into care planning so that we can create a plan of care that includes the patient's wants, wishes, and needs. This is that chubby little baby that you saw in the first picture back in 2004. That's right, I'm gonna be a mom of a teenager. She's 13, getting ready to turn 14, May 10th. And I got here through a multidisciplinary team of professionals, utilizing their natural abilities, a therapeutic use of self, treating me from a client-centered approach. It was the perfect storm. It was the perfect combination to get me where I am today. And today, after all this happened to me, I wanted to be like you. I wanted to be like everyone else in this room. I wanted to go into healthcare. I spent 2 years in physical therapy learning to walk again. I put myself back through college. I have a degree in psychology. I have a degree in allied health and human performance, a master's in occupational therapy. I am a director of rehab for Future Care, a company that I've worked with for almost 10 years. So I'm almost at that 10-year marker. And I absolutely love what I do every single day. I wanted to be part of you. I am thankful for everything that you all did for me. And now my goal is to give back and do the same in return. So if you take anything from what I said today, remember, stop treating the diagnosis and start treating the patient. Thank you for allowing me to share my story.